Hello, good evening, my viewers and my friends. Today, actually, I had gone through a article in Ahmedabad Mirror. Then I just went through the real information. The the information was that the statin therapy can reduce the heart disease in elderly over 85. Now, this information has come from the recent study. The paper had been published on 28th of May, that is this 28th of May 2024. And this study had been published in the Annals of Clinical Medicine, where they have just given this information in the abstract that of the 42,680 adults aged 75 to 84 years, follow-up period was about 5.3 years. So they've taken people 75 and above that, okay, because this kind of study had not been done earlier. Many were not there to support that even older people can benefit from statin therapy. So in this study they have said that out of the 42,680 adults of age group 75 to 84 years, from them 9,676 people on statin therapy, they develop the CVD. That is, the percentage is quite less. And amongst the 5,390 adults of 85 and above age, out of them 1,600 developed CVD. So according to them, statin therapy is associated with lower incidence of CVD and all-cause mortality. I went through this article, that is, which abstract has been given in the Annals of Clinical Medicine, that is the abstract. In that they have said that there is a limitation as two confounders related to lifestyle, that is the diet and the physical activity, that has not been taken into account. So if we consider this study, then we can say that it's not complete study, because these two things are very, very important, because it is these CVD, diabetes, various diseases are considered lifestyle diseases. And if we are not considering the lifestyle of each and every individual, then if they're getting benefit from statin, only from statin, that is doubtful. Now, it's okay, they have found out this, that statin is beneficial. They're going to spread this information amongst the people. Before that trickles down amongst the elderly and the people suffering from CVD, and they start grabbing their statins and think that they're going to be hale and hearty and live longer. Before that, just please listen to what I want to say. See, cholesterol is very, very important. I don't understand this concept that why LDL is termed as a bad cholesterol, because it has lots of benefits. Cholesterol has lots of benefits. Our neural transmission, our mental health, our cellular integrity, our plasma membrane integrity, even the insulin receptor processing and signaling, many, many things. Then you can say in modulation of the inflammation, then protection from vascular calcification, cell repair, muscular function, the formation of ATP or the function of mitochondria. All this is very much dependent on cholesterol. And LDL is also a part of it, because it carries a lot of cholesterol and delivers it from the liver to the tissues. And there is a balance between how much is delivered and how much excess is there, which has to be removed, which is done by HDL, which takes up the excess or scavenges the excess from the tissues and to the liver for excretion or for other processes. So in the biliary tree, the cholesterol is actually processed. So if I consider all these benefits, I should say that tampering with the lipoproteins in general, or LDL in particular, is really, really very harmful, because when millions of years of evolution has endowed it with biologic functions, then why we human beings are tampering with this balance of LDL, the functions of LDL? It's very, very bad. Now, if you consider that LDL is bad, it shouldn't be in our body. If we don't have LDL, we are very, very happy and healthy. then I would like to remind people from scientific background that there is a genetic defect which is known as a beta lipoproteinemia that actually says that the ApoB containing lipoproteins are not produced in them due to some genetic defect. So in that case, LDL should be absent in these people. So it is absent. Now, what is the case in this? Will they live happily ever after? They will live for 100 years or more? No, they die in the 3rd or 4th decade of their life with various problems. They have recurrent infections, very difficult for them to thrive. They have muscular movement disorders, okay, that is ataxia, which is told. They have dysarthria, they have skeletal issues, they can have blindness, they have cerebral degeneration, they have severe vitamin A, E, K and D deficiency, which are fat soluble vitamin, which are very, very important, and they, for their transport and absorption, we require the lipoproteins, okay, and LDL is one of them. We require cholesterol, we require fat. Then these people can suffer from fatty liver also and liver cancer. So there are so many problems happening due to the absence of these LDL, okay. So it happens that we don't learn from nature. Our nature state, we can say, we like to do of our own, and this you can say start of usage of statin has started from this kind of thing only, from this kind of an attitude, mentality of thinking that we have to do something about LDL without thinking about the benefits of LDL. We are targeting one molecule that it will relieve of all the CVD issues, and it will make a person with cardiovascular issues to live longer. But why on earth LDL has been defined, has been put in our body, or it has been put in this lipoprotein metabolism? That's very important to understand, and that I have always said in my videos, that statin does not target the small dense chemically modified LDL particles, which are the main culprit in forming the plaque and leading to atherosclerosis and then MI and various cardiovascular issues. Okay, it is lowering the cholesterol, and that one single kind of a hit, just lowering the cholesterol, is not going to do benefit to that person. It's going to do much harm to that person. Now, what are the biologic functions of cholesterol? There are so many. Various intermediates produced in the cholesterol metabolism. There are many. They are very, very important. Now, statins target what? They target the conversion in the process of cholesterol biosynthesis, the conversion of one compound, hydroxymethylgluteryl coenzyme A, that is known as HMG-CoA in short, to mevalonate. Now, statin competitively inhibits one enzyme which converts HMG coenzyme A to mevalonate, which is a regulatory pathway. In this way, it stops the cholesterol synthesis. Finally, if we consider that this is not inhibited, the mevalonate will convert to mevalonyl pyrophosphate, then isopentenyl pyrophosphate, then geranyl pyrophosphate. These are the intermediates which are produced. Isopentenyl pyrophosphate, an intermediate in cholesterol biosynthesis, is very important in forming such selenoproteins. It enters the protein synthetic machinery and increases the transcription and translation of selenoproteins, which are very important antioxidants. So it is protecting cholesterol through its intermediates, is protecting the body from oxidative stress. So it's very, very important. Then we have one compound which is known as farnesyl pyrophosphate, another intermediate, and that is important in formation of coenzyme Q10, which acts as an engine to fuel the mitochondrial function. As an engine fuels a car, similarly it fuels the mitochondria to function and produce ATP. So there will be energy depletion if the cholesterol is low. Okay, because coenzyme Q10 will not be produced. Another thing, selenoproteins will not be produced, so you will be having oxidative stress, free radical formation and inflammation, which is making you more prone to other kind of diseases. Then another important compound formed from these intermediates is dolicol. Dolicol is very, very important for insulin signaling because it causes the glycosylation of some insulin receptor substrate present in the cell, and this process leads to the proper processing of the insulin receptor and then the proper signaling, which will open the GLUT4 receptors present on adipose tissue, liver and the muscles, and will cause the entry of, after the binding of insulin, the entry of glucose and then usage of glucose. In this way, it is very important in maintaining the glucose levels and preventing the insulin resistance. Okay, because on the cell we have some kind of a rafts, or you can say there are receptors which require cholesterol. So cholesterol actually present on the upper surface of the cell membrane, and it modulates the binding of insulin to some special pit-like receptors which are known as cabuli, and when the insulin binds to it, okay, and these then cholesterol rafts, you can say, these cause the modulation of the activity of insulin. On the other hand, the dolicol, which is formed from cholesterol, initiates the process of glycosylation, which causes the processing of the insulin receptors, and the signaling of insulin takes place, which results in the opening of the GLUT4 receptors on the adipose tissue cell, on the liver cell and muscle cells, which causes the entry of glucose and the usage of glucose. So if you are taking statins or you are lowering your cholesterol, you are actually interfering with the proper processing and signaling of the insulin molecule, and this will result in inability of the GLUT4 to open, and that will result in hyperinsulinemia, and that will result in insulin resistance, and you are not using your glucose, so that will result in hyperglycemia. Over a period of time you will become diabetic. So if a person is not dying of CVD, the person is going to die of diabetes and other problems. Okay, there can be cancer, there can be all cause mortality. Another thing is, if statins were so protective, earlier it wasn't used much, but nowadays it's rampantly being used. So why there are so many deaths? Due to cardiovascular issues. We shouldn't be having lesser deaths due to the cardiovascular issues, or we can say that why these complications are happening. Is it due to some underlying problem in the drug therapy which has been given to these patients? No one tries to cater to these problems. Instead, it is like kind of a treatment given to all the people without considering an individual different from the other individual. I always said, I have said in the earlier talk also, that bio-individuality is very important. When you have to treat a person, treat that person as an individual, not as a person who has come in a herd, that there are 10 people with diabetes and you are just counting that one person as an extra diabetic person. Bio-individuality is very important. A holistic approach is very important in the treatment of the people. Okay, even if they have the same kind of disease. Now, there was a study in which around 10,000 women were on statin therapy and 14,000 were not taking any statin. 3 years later, it was seen that the 10,000 women on statin therapy had a 10% chance of having diabetes, and the 14,000 approximately women not on statin had about only 5 to 6% chances of having diabetes. And in Asians, it was seen that there was a 7 to 8% more chance of diabetes in women taking statins. Okay, so depending on the various populations, this may differ, but in Asians, in Indians, the statin can lead to more percentage increase in diabetes, okay, in the risk of diabetes. Now, most important is that now intermediates are very important, producing various compounds which are important in various pathways which are due to cholesterol itself. Okay, that we have discussed: insulin signaling and the ATP formation, coenzyme Q10 functioning as a spark plug of an engine, so it actually fuels the mitochondria to produce ATP. So all these functions are very, very important if there is a normal cholesterol level. Now, in a Japanese study, it was shown that those taking statins and with low cholesterol were more diabetic. So if cholesterol is being lowered, the person becomes susceptible to more problems, I would say. Okay, because what we are doing is we are decreasing the amount of the various other important intermediates formed in the cholesterol biosynthetic pathway. Then in one Danish study, okay, statin use was linked to the reduced cancer related mortality, and it was seen that around 2 lakh of the subjects, they never took statin, and they were about 65 years older. And another group, it was like 18,000 subjects on statin therapy before cancer. Now this kind of unfair comparison, it shouldn't be there. Instead it should be like we should be segregating that high intake of statin, intermediate intake, or low or moderate intake. In this way we should segregate the subjects and then see the in a follow-up that how much they are actually exposed to kind of different mortalities, or you can say different kinds of other chronic problems. Okay, now high cholesterol in cancer is associated with more chances of survival. Now you are giving, the person is taking statin, person is having cancer, cholesterol is low, that person will have a less chance of survival. And if that person was not taking any statin, already he might or she might be having cancer, but still there are chances that the person might survive for a longer period of time compared to those who were taking statins and having cancer. So this is also a kind of study which has been done. Then another thing is that it has been seen that in a study that some subjects were studied. One group was considered as taking statin, another group was considered as not taking statins, and the problems related to statin intake was seen, and the patients reported myalgia, weakness in the muscular weakness, fatigue, shortness of breath, memory issues. So the statins were stopped. When the statins were stopped, it was seen that in those 328 subjects, 50% of them improved after stopping the statins, that is relieved of these symptoms of myalgia, shortness of breath, fatigue and memory issues, and 50% did not recover or did not find any improvement. It's not that when you cease taking the statin, the symptoms will revert and then you will feel better. It's not for all. It depends on individual to individual. So once you have started the statin, it is recommended that you have to take it lifelong. But then if you want to cease it, you want to stop it, it will be very, very difficult. It is not full proven that you will be relieved of the various symptoms. So this is the major thing. Okay. And then various studies have also been conducted, in which one study was conducted in which it was conducted in Japan, and the Society of Cardiology, okay, they said that if the cholesterol is more than 220, the Society of Cardiology in Japan, they said that if the cholesterol is more than 220 milligrams per deciliter, then all should be recommended statin. Now, this was the lipid intervention trial conducted in Japan with low dose of statin, simvastatin. 41,000 with cholesterol more than 220 milligram per deciliter were treated with simvastatin for 6 years, and it was seen that they were having more of strokes, they were having more of other issues and more of mortality. So what is actually coming out of these studies? I don't understand. That statin is doing what? Now what is the reality of all these things? Now we have in the center the pharma sponsored clinical trials, whether the trial is conducted by the American Heart Association, whether it's conducted by Annals of Clinical Medicine, whether it's conducted by the AMA, such big bodies, it's not 100% sure that this is a real study, where the data can be manipulated to a greater extent in the benefit of the pharma companies. They can manipulate the percentage of mortality, deaths, or any kind of such a negative impact of that drug to their preferences, so that they can sell their drugs. In that process, they have a network. One will be, they will choose a clinical site. So we have a pharma company, they have chosen a clinical site. They will choose the physicians who will follow what they want. These physicians are going to be paid a lot for speaking the language of the pharma company. Then they will deploy a central educating committee that is known as CAC, which will pay the which will actually which is the expert committee. Okay, so we have a physicians lobby, we have an expert committee, then we have the data safety and monitoring committee, which is going to pay, okay, the patients and take care of those patients who are going to be considered in that study. Then there will be the FDA, okay, the drug agency, which is going to approve the drugs. And this is kind of an association between the FDA and the pharma sponsored clinical trials, is like a revolving door. Both benefit from each other. Okay, so FDA is involved in that also, they are biased too. Then we have the various medical journals like the ACC or the AHA, AMA, these big platform agencies or journals, which will be earning money by reprinting the publications, advertising the study. Okay, so this is kind of a network. Academic societies, AHA, AMA, everyone, they are involved in this. And then you have, so what is this, is that if you actually come across some meetings of these kind of clinical trials between the pharma companies and the academic societies, you will see that the pharma companies, they dominate so much that the academic societies have to do according to that. So there's a lot of manipulation and wrong presumptions are made by the pharma industry. We have to talk of absolute risk reduction, ARR, not of relative risk reduction. Studies showing relative risk reduction can be confusing. So talk of absolute risk reduction. Okay, so that is the point. Okay, then another is a PCSK9 inhibitor, which is again one new entrant in the statin community, which I'll discuss afterward. That also is a problem here. Then one study was, yes, very important, statin therapy causes increase in vascular calcification, because in the cholesterol synthesis some intermediate is formed, which is very important in converting the vitamin K1 to K2, which prevents the calcium deposition or plaque formation of the vascular smooth muscle cells. So if you're taking statins, then this K1 to K2 conversion will not take place and the vascular calcification will take place, which will make you all the more prone to problems, exaggerated issues, and you may die earlier also. Progression, one study was done, which is title is Progression of Vascular Calcification Increased with Statin Use in the Veteran Affairs Diabetes Trial, VADT study, and there 4.4 years period it was, and this calcification causes cell death, which is induced by the statins in the vascular smooth muscle cells. Another point will be regarding the other kind of drug, which I'll take afterwards. It will be a long discussion, but in nutshell, the summary is that cholesterol is beneficial. LDL is not at all a very bad cholesterol. It delivers the cholesterol to tissues, which has a role to play, lots of roles to play, and decreasing cholesterol is not the answer to protect a person from CVD. And please, when studies are conducted, I just plead and request the Annals of Clinical Medicine, clinical chemistry, that they please take care of lifestyle confounders also, like diet and nutrition. They play a big role in protecting the person from complications of CVD. So it's not only statins. Okay, it's important that we take into account the kind of the activity or the kind of lifestyle that individual is actually doing. Okay, so I am really very disappointed with this article. In the morning I read this, that I was shocked, and I just went after it, that I have to find out what is this, and I found that this is just a kind of very small information, incomplete information, but still the newspaper people are publishing this without reading the whole article and without going through various other information regarding statins. Earlier also a lot of doctors, renowned doctors and people have given statements about the problems related to statin. But before taking into account all these things, this has been published and people will read it and go through statin, go after statin. So I plead, please don't start statin therapy just when you see that your cholesterol is rising. There are many ways to decrease your cholesterol, and high cholesterol is not a factor causing the cardiovascular issues. There are many other things, and that mostly is related to your diet and your lifestyle, how amount of activity you're doing, and your stress level. So please take into account various other issues also. Bye. Take care.